Welcome to the Deep Dive. Today, we're embarking on quite a journey, actually. We're looking into healthcare.
Specifically, medical tourism in China.
Right. Our mission really is to figure out why. Why are more people heading to China for medical stuff? You know, from basic checkups right through to really complex surgeries.
Yeah, and we've really gone through a lot of material. News reports, personal stories, detailed cost breakdown.
That's a real mix.
Exactly. We're going to unpack what's making China, a stronger contender for global patients. And I think some of the stuff we found on quality, cost, access, it might surprise you.
Okay, let's jump right in then. The big one, cost. It's often the starting point, isn't it?
Almost always.
And our sources, well, they show a huge difference. I mean, take heart surgery. You might be looking at, what, $100,000, maybe $150,000 in the U.S.?
Easily. Sometimes more.
And in China, we're seeing figures like $15,000 to $35,000.
Oh.
Or a knee replacement, maybe $35K to $50K stateside.
Yep, that sounds about right.
Versus maybe $8,000 to $20,000 in China. We even saw this one report, an ER visit, meds included, just $75 in Shenzhen.
$75?
Yeah. I mean, these aren't small differences. It kind of shakes up how you think about healthcare costs globally.
It absolutely does. And what's really interesting is why it's cheaper. It's definitely not about cutting corners on quality from what we've seen.
Okay, so what is it then?
Well, it seems to be things like, lower operational costs, salaries are different, supplies cost less. Plus, and this is key, pretty significant government price controls.
Price controls on drugs.
Exactly. Pharmaceuticals are a big one. Generic drug prices, they can be like 70 to 90% lower than in the U.S. because the government sets price ceilings.
Yeah.
And there was that recent thing, too, the government capping dental implant fees at public hospitals. Brought a single implant down to about $642. That's way less than elsewhere.
Okay, those numbers are, they're pretty compelling. But you know what surprised me even more digging into this? It wasn't just the price tag.
Right. There's more to the story.
Definitely. The research really seemed to point towards China's commitment to quality and speed. Incredible speed, actually.
To good access.
Yeah. You know how it is here? Waiting weeks, sometimes months for a specialist?
Yeah. Tell me about it.
Well, we found this one patient account. They saw a top oncologist in Shanghai within 72 hours.
72 hours. That's potentially life-saving.
Exactly.
So, okay, how do they manage that kind of efficiency?
Good question.
Well, top hospitals, like Peking Union Medical College Hospital, which, by the way, ranked number 24 globally in 2024, pretty impressive they have these VIP fast-track services.
For international patients.
Specifically. And they're using tech, too. AI-optimized scheduling, apparently cutting non-essential waiting times by like 30–40%.
Wow. Using AI for scheduling.
And for diagnostics, too. We saw reports of AI systems analyzing scans with 95% accuracy.
95%.
Yeah. Which means doctors get really precise info, and it helps cut down on, misdiagnosis rates. That's huge for patient confidence.
Absolutely. And it's not just about the sort of Western-style high-tech stuff, is it?
Oh.
There's the whole traditional Chinese medicine angle, TCM.
That's right. And that's where China offers something quite unique, actually. They integrate modern medicine diagnostics with practices like acupuncture or herbal treatments.
How does that work in practice?
Well, a really striking example is something called the Shanghai Protocol. It's for a specific type of leukemia. It combines chemotherapy with an arsenic-based TCM treatment, and the reported remission rate, 99%.
99.
Yep. It's seen as a real landmark in integrative medicine. That holistic approach is something a lot of patients are looking for now.
So, okay, you've got the lower costs, the quality, the speed, this blend of medicine. What about the practical side for someone actually going there, the logistics?
Crucial point, because navigating healthcare abroad can feel, pretty overwhelming.
For sure.
But the sources suggest China's really worked on streamlining support. Top hospitals often have multilingual staff, navigators who speak, 15+ languages. They use certified medical translators, too.
Makes sense.
Yeah.
Communication is vital.
Absolutely. And then there's insurance. Seems that they've got pretty seamless integration with global insurers. Partnerships with over 2,000 international companies for direct billing.
Direct billing, so less hassle for the patient.
Exactly. And apparently, in some places, 97% of overseas insurance reimbursements get processed within 48 hours.
That's fast.
Very fast. Add to that, easier visas now, expanded visa-free options, simpler applications, plus generally lower living costs while you're there.
Yeah.
It all adds up.
So this deep dive, it really paints a picture of a rapidly changing landscape. China's becoming a really significant player in global healthcare.
No question, it offers some very compelling options.
It certainly does, and it makes you think, doesn't it? With healthcare costs rising everywhere, how might the accessibility, the advancements in places like China start to reshape our own choices for treatment? And maybe even, redefine what local healthcare even means in the future.
That's the big question, isn't it? Something to definitely keep an eye on.